Good afternoon. My name is Veronique Poirier, and it's all come up already. And I'm going to talk something which is a bit drier for you all, but I will try to make it easy and interrupt me if you don't understand something. I'm presenting this talk on behalf of PHE England, and I say on behalf of PHE because I'm actually not with PHE anymore. I left the organization 6 weeks ago, but as I was still in post when Imogen asked me to present the talk, I thought I would carry on. PHE is Public Health England is hosting the cancer registry in England. And I would say that we are actually, I was based only about five minutes from here because the Bristol office of PHE England is actually the lead for skin cancer in England. So if the data I'm going to present are, although I was asked to talk about the UK, in the UK we have 4 cancer registry. And although we are working quite a lot together and collaborating, at the time we don't have a complete pool of data coming together. So some of the data I'm going to present to you are UK-wide, because actually some of them I've taken them from my new employer, Cancer Research UK, and some of them will be based on data we've done here more in Bristol at the PHE office. So if I start first by putting the UK within context of Europe in terms of incidence, you will see, you probably can't see at the bottom on the right, there are this sort of ranking of how high is the incidence within the different country. And you will see that Britain is very red, the same than Scandinavia and some other smaller countries like the Netherlands. There are a number of things we need to say about that, which is probably, obviously, there is definitively an effect probably linked with the skin type of Nordic people and the lifestyle. Maybe more exposure to sun because of the lack of sun in our country, on the north. But also that we need to take into account that despite the fact that sometimes the cancer registry can be criticized for the quality of its data, we have actually some fairly good coverage of cancer. Normally all cancer cases in England and in the UK are registered, which is not the case for all the country in Europe. So comparison cannot be exactly the same sometimes between countries, and we need to keep that in mind. In terms of mortality now, we see that actually England, UK is a bit better, but still sort of middle of the range in terms of the rate of mortality from melanoma. So if I moved on to the next slide, here I just put you the number of that's the latest data we have. Obviously, registration is a bit of a slow process, and therefore there is always a gap between the year we can actually publish data. They are in England. They are now they're hoping to have completed the 2015 data in September. This means that the analysts will have access to it sort of by Christmas or something like that. So you can see here, obviously, England has the largest amount of newly diagnosed melanoma cases in the UK. These are data that represent what we call the trend over the year from 2005. On your left, the male and female, and you can see that we got Scotland, England, Northern Ireland, and Wales, and you can see a steady increase in the number of cases. What we've been using here is what we call the age standardized incidence. It's a way of expressing the data in a way that we actually remove the factor of age factor within the population, because cancer is obviously affecting older people in general, and therefore you need to remove this aspect of age to be able to compare different region and different geography. So what we can definitively see from that, if you focus maybe on England, because in England having more cases, there is less variation in the curve. England is in blue, and you can see that the male for the male, the incidence is going faster. The slope is actually sharper than for female, and this is something which has been observed for a number of years now. In terms of mortality, we have, for Northern Ireland, you can see these big changes because that's obviously a small population of people. So therefore, where there is a change, it does affect. It has more an effect on the data. But again, if we focus on England again, we can see that male again have a higher mortality rate than female, and going up more than when female is actually is a little bit more static. Again, if you focus on the blue line, it's probably easier. This one is actually data from Cancer Research UK, and you can see, I think, an interesting shift, which when I started working in skin cancer years ago, we were always told that female had the highest level of melanoma, and you can definitively see the shift here around 2005, 2006 of male, the light blue line going over the female rate. This I just show you that because it's something we did here. It's quite older data in 2012 by CCG. Just I wanted to show you the variation in England at local level, and I'm sure that we would have the same type of pattern if we were looking at Wales, Ireland, and Scotland. And you can see that here in the southwest we are actually the darker color, the highest incidences. So we have a quite high incidence in the southwest. This is the mortality, and there the southwest is not probably the highest, certainly for male. For female, there are a bit more maybe, but it's still quite dark. But there is also a very big variation between different CCG in England. This is data from Cancer Research UK again. From actually collected because the data in fact come from the cancer registry initially, and it's they put a sort of a bar chart that you can see. It's just to show you at the bottom you have the age at diagnosis, and definitively you can see here an increase in female age, sort of younger female, basically, more cases in younger female than male. And then there is a shift, as you can see, in the higher bar. The blue bar are the male, obviously, and you can see that from 65 onwards, there are higher number of cases in male population. And the line above is to show it's an age-specific incidence again, to show the quite sharp increase in male population of diagnosis of melanoma. To go on to the survival, this is again, we have this is in England, we're always comparing ourselves with other European country and Nordic country and South, and mainly actually it's often referred to the Nordic country because they have more similarity in their health system. And we can see here for the Northern Europe, there is a higher survival than the UK and Ireland. That's a 5-year survival for patient. This is, sorry, it's a bit busy, but it's just to show you the place of the in terms of survival, 1, 5, and 10 years. I mean, maybe don't look into the detail but you can see that melanoma is actually quite high compared to other cancer in the UK. This is something we did here, and we were comparing at the time England, Northern Ireland, and Scotland, and you can see that the blue bar are the male and red female. It's again age standardized survival, and it shows that there is actually again male in England have a lower survival than female. And overall, there is a little bit of bits, although this is not significant, but there is lower survival in England than in Northern Ireland and Scotland. Although it's not very big, but it is nevertheless present. I just wanted to show you that as well, because again, the cancer registry have always had a problem with being able to do analysis on staging and sort of give some good survival related to staging and things like that. 3 years ago now, there was an initiative to try to improve the staging survival in England, and that's the result. And you can see if you get the unknown at the bottom is the number of cases now which are actually not stage, and it's been a much improvement in this data, which is very good because it's allowed further study to try to really more focus on specific maybe treatment for and survival for late cases. I need to rush off a bit. And this is the first time that the PHE has actually published some data on the ONS website, on collaboration with ONS, looking at the survival by stage. And it will be, this is for England data, and it's been published last Friday, so they are fairly new data. And you can see that obviously the stage 4 survival is worse overall for the cohort. There has always been an issue with the melanoma is actually cancer of the most affluent population rather than some for other cancer, which are for lung cancer, which is more prevalent in the less affluent population. And you can see here this level 1, 2, 3, 5 are the level of income deprivation for the population, and you can see the higher incidence in the most affluent population. And this one is the anatomical distribution. Again, there is a difference between male and female, as you're probably aware, that male has a very high incidence on the trunk, female have a high incidence on the the legs and the hips. And here I've just put something which is just looking more at the breakdown of the head and neck, because I always think it's interesting, and people are not always aware of that, of the fact that male are often, and it's the same for non-melanoma skin cancer, male are often getting more cancer on the ears and the scalp than female. So to conclude, basically, melanoma is the 5th most common cancer in the UK, and it has quadrupled in Great Britain since 1970. The increase is larger in male, where the rate has increased more than 6 times, than in female, where the rate have more than triple. Melanoma has shown the second fastest increase in incidence in men overall in all the cancers, so it's actually going up very, very fast. And it's something which really need to be addressed in terms of prevention. Around half of the malignant melanoma cases in the UK are diagnosed in people aged 65, but we've seen that there are also quite a lot in younger women. And I would finish on a positive note, is that malignant melanoma skin cancer is improving and has doubled in the last 40 years in the UK. Thank you very much.